Vomiting in cats can occur as a response mechanism to intoxication or as a consequence of the development of a pathology which affects the digestive system. Knowing the most common causes that explain this form of regurgitation can help us to avoid them in future or act quickly if they occur. This is why Animal Wise explains the 8 most common reasons why your cat vomits and which will necessitate a trip to the veterinarian. An incorrect diet can prompt digestive problems in the animal which result in vomiting and/or diarrhea. Cats are obligate carnivores, so it's necessary to provide them with a diet based on the consumption of quality protein, such as can be found in meat and fish. On the other hand, it should be noted that a sudden change in diet can also produce vomiting and diarrhea. Cats are very sensitive creatures, so any dietary changes should be introduced progressively to avoid these problems. Similarly, eating too much too fast can also lead the cat to vomit. We may only give our cats a few treats a day, but their bodies will expel them if unsuitable. Rewarding good behavior is essential for a happy coexistence and strengthening our bond with a cat. However, there are many ways to do it. We can use petting, words of encouragement, or pampering instead. If we do want to use food as treats, there are some fruits suitable for cats. Although distinct problems, both food intolerance and allergies can bear vomiting and diarrhea as the main symptoms. Similarly, it is common to notice skin changes such as irritation, inflammation, redness and itching in some parts of the face, ears or even undercarriage. Gastroenteritis is defined as inflammation of the gastrointestinal tract and can have various causes from poor digestion to infection. In these cases, in addition to vomiting, we can sometimes observe diarrhea, malaise, lethargy and even fever. If your cat has gastroenteritis, it is essential you keep them well hydrated. If we have not previously noticed our cat vomiting, but it starts too suddenly, we might suspect they have ingested a toxic substance which their body is now trying to eliminate. Poisoning can be due to the ingestion of certain plants, cleaning products, herbicides or pesticides. In this case, the vomiting is likely accompanied by other symptoms such as lethargy, lack of coordination, or excessive salivation and requires urgent veterinary attention. Some disorders such as intestinal malabsorption can cause vomiting and malnutrition in cats. Similarly, metabolic disorders such as hyperthyroidism can also cause vomiting. Other causes include a lack of digestive enzymes and diseases such as colitis or pancreatitis. Diagnosis of these pathologies can be established in a simple way by means of veterinary examination and a blood test. The hygiene routine of a cat can lead to the formation of trichobezoars or hairballs. They can cause digestive problems when ingested as they create blockages. In these cases, the vomit will be in the shape of a cylindrical plug accompanied by fluid. To avoid the formation of these hairballs, it's advisable to brush the cat every day, add fiber to their diet, and provide them with malt paste. If none of the above causes explain vomiting, then we should think about the development of a disease. Viral and bacterial infections can cause digestive problems in the animal, leukemia or panleukopenia being such examples. The most important thing to do when your cat vomits is identify the cause, as some are serious and require veterinary treatment. When vomiting is caused by poor diet, we should simply review all the food we give them and adjust according to their nutritional needs. In case of an intolerance or food allergy, we will have to identify the food which produces the reaction and remove it from their diet. When the problem is due to poisoning, a disorder or disease, it will be necessary to visit a specialist as soon as possible.